Holly is a 19-year-old female who was just diagnosed with lung cancer. She comes in to see Amy, a third-year nursing student, a few days following this diagnosis to chat. We are using person-centered therapy and cognitive behavior therapy techniques, allowing the counselor to dive into the client's issues and structure them around their preferences. Person-centered therapy's main idea is that the client knows what is best for them and can lead the general direction of therapy. It is proven to aid people who are in stressful situations or when they are experiencing a chronic problem that affects their functioning. Person-centered therapy is the most holistic approach that focuses on more than just the physical health of the patient. On the other hand, cognitive behavior therapy emphasizes how our thinking impacts the way we feel in our day-to-day life. The goal of cognitive behavior therapy is to change emotions, first by changing thoughts and behaviors. For example, if a person is experiencing anxious thoughts, those thoughts will influence a person's behavior to minimize their feelings of dread and worry. Changing those negative thoughts into positive ones will allow the client to grasp onto their full potential of self-healing. Using both these techniques, we will ensure that we are using positive communication skills such as empathy, genuineness, active listening, reframing, and unconditional positive regard. This combination of therapy will work best to attain a holistic and client-centered solution.
Hi Holly, my name's Amy. I'm a third-year nursing student at the U of S. How are you doing today?
Hi Amy, I could be doing better.
Oh, I'm sorry to hear that, Holly. I just kind of wanted to lay out the expectations for the session today, so we have about 10 minutes to talk, and anything you say will be confidential unless I suspect abuse, self-harm, or the harm of any other people. Are you okay with that?
Yeah, that sounds good to me.
Okay, perfect. I've heard that you've recently experienced a cancer diagnosis that's been pretty hard for you. How have you been dealing with it lately?
Well, I've been feeling really stressed about it since I found out and really anxious, and just overall I don't know how I'm gonna tell my family, and I don't know how I'm gonna cope in general.
So what I'm hearing is that you have a lot of anxiety related to telling your family about this?
Yeah.
Want to tell me more about why you find it hard to tell your family?
Well, I can hardly believe the news myself. I feel like sharing the news with other people makes the diagnosis more real.
More real?
Yeah, I feel like by telling the family, it solidifies the diagnosis and brings more attention to the reality and the possible outcomes of cancer.
Yeah, I can see how that's really overwhelming for you, Holly.
The counselor stating, "I can only imagine how you must be feeling," is an example of empathy. This is a key concept of person-centered therapy, and it shows how the counselor is listening and understanding to the client. Empathy is important in therapeutic relationships because it facilitates a safe environment for the client to share goals, anxieties, and experiences.
That's a really good place to start, Holly. When do you think you want to tell your parents about your diagnosis?
Well, I was thinking I could probably tell them tomorrow.
Okay, that's really good. I'm really proud of your initiative and your strength, and I'd really admire that. How do you think you'll tell them about your diagnosis?
By the counselor expressing that they admire the client's initiative to tell their family soon is an example of unconditional positive regard. Unconditional positive regard is about respecting the client as a human being with their own free will and operating under the assumption that they are doing the best they can. Having the attitude toward a client can encourage them to share their thoughts, feelings, and behaviors more openly.
Well, I've been thinking about telling them, and I've come up with so many ways, I don't know which way would be the best to tell them.
That's totally okay to be uncertain at this point. Tell me more about your family. What's your family dynamic like?
Well, my family, they're really supportive, and I have a really good relationship with my parents. It's just giving them this life-altering news is really stressful, and I'm scared that I'm gonna really change the family dynamic by telling them this news.
I can see how this can be hard for you, Holly. Cancer is such a life-changing diagnosis, and you're doing really well so far. What reactions are you expecting from your parents?
Well, I think they're gonna be really sad, and I'm sure they're all gonna cry. I just need to prepare myself for how I'm gonna tell them.
Would you like to try practicing with me?
Yeah, I think I would really appreciate that.
Okay, just imagine that you're sitting in your living room talking to your parents about your diagnosis.
Okay. So, you guys know how I've been feeling really sick lately? Well, I went to the doctor and I got a bunch of tests done, and it turns out I have lung cancer.
Oh my goodness, Holly. Wow. When did you find out?
Well, I found out a couple days ago, but I went and got the test a little while back.
How come you never told us earlier?
Well, I was just really scared about what you guys were gonna say and what you guys were gonna think, and I didn't want to change the entire family dynamic.
You do not have to be scared of that. We'll always be here to support you, Holly, okay?
The counselor suggesting to the client to practice telling their family is an example of role-playing, which is a key concept for cognitive behavioral therapy. It allows both the counselor and the client to involve active participation into the session. Role-playing will allow the client to understand thoughts and behaviors in the situation they are facing, while maintaining a safe environment to explore those strategies.
That was really good, Holly.
I don't know, I don't think it was really that good. I'm just really scared to tell them.
I can totally see how the situation is hard for you right now. Have you maybe thought of reframing the negative thoughts, and maybe telling your parents will be beneficial for you because it'll allow them to come to terms, and it'll also allow them to be kind of a support for you? Maybe we could try changing the negative into a positive?
You know, I never really thought about it like that. That makes me feel a lot better about telling
that's
them.
good.
Suggesting that her family could be used as a support system is an example of reframing, which is a key concept of cognitive behavioral therapy and is a skill to replace negative thoughts with positive ones. Reframing can help the client become more self-aware and explore how their thoughts are connected to their behaviors. Reframing can also allow a client to handle life stressors through healthy coping mechanisms.
I'm really glad to hear that, Holly. So what I'm hearing is that the reframing really helped you with your perspective on telling your parents, and that the role playing kind of gave you more insight into how you'll talk to them about it. Is that right?
Yeah, I feel more prepared to talk to my family now.
That's really good. Is there anything else you'd like to talk about in this session, or anything more regarding your parents or your family, or any coping strategies?
I don't think so. I don't think I have anything else to add about my family, at least, but I would really like to talk about how I should cope.
Definitely, yeah. Coping is really important, especially when you have big news like this.
I just feel like I've never had to deal with something this extreme, and it's a lot to handle.
That's totally fair, Holly. Have you used any strategies in the past to help with any stressors in your life?
Well, I've tried running, but I didn't really like that, nor did I feel like it benefited me in any way.
Okay, well, do you have any other strategies you've used?
I've tried journaling, and usually I find that sort of helps.
Well, that's good. How would you say that helps you?
Well, usually when I journal, and I'm feeling like overwhelmed how I am, I journal everything and I put all my thoughts onto the paper, and then afterwards I go through them and figure out if there's anything I can do about the thoughts, and then if not, usually I'll just wait for a bit and come back to them.
Well, do you think journaling could apply to the situation you're in right now to help you feel better?
Honestly, I think that would actually really help.
Okay, Holly, that's a really great start. Do you think journaling would help you in this situation with your diagnosis?
I think it could help. I don't really know where to start.
Okay, that's okay. Where did you start when you were doing journaling before?
Well, usually when I'm really overwhelmed, I start by just writing down all my thoughts and my feelings and just get them from my head onto the paper. And then afterwards, I go through them and figure out if there's anything I can do about them. And if I can't, then usually I'll just take a break and come back.
Okay, so what I'm hearing is that journaling kind of gives you clarity on your feelings just by writing them down on paper, and it kind of gives you a solution to your issues or your stressors that day.
Yeah.
Yeah?
Yeah.
Okay. We could totally try doing that for you. Does that sound like a good plan?
Yeah, I do think that could actually really work in this situation.
So do you have any other strategies that you maybe would like to explore with this new diagnosis?
Well, I don't really know if there's any other strategies that I can think of, but I feel like nobody can really understand what I'm going through.
Oh, I totally understand that. Do you think it would be beneficial for you to talk to someone who maybe is going through something similar?
Yeah, I don't know where I would go to talk to somebody who's going through something similar. Like I don't know how I would get in contact with anybody in the similar situation as me.
That's okay. Maybe have you ever thought about joining maybe a support group in the community?
I haven't actually. Do you think that would be beneficial for me?
Well, I can't really answer that for you, but maybe we could try and explore some options and see if that's something you would enjoy.
Yeah, I think I would really like that. I feel like joining a support group I could, get to know other people who are maybe going through something similar and have someone I can relate to better.
Totally, and support groups can help you with your diagnosis and other supports in the community, not just the support group. Is that something you'd like to explore?
Yeah, definitely.
Okay, perfect. So what I'm hearing is that joining a support group would really ease your anxiety about kind of the unknown about your diagnosis.
Yeah.
Yeah, okay, I can totally give you some resources at the end to join a support group.
Yeah, I'd really appreciate that.
Perfect. And do you have anything else you'd like to touch on in this session?
I don't think so. I think we've covered just about everything, really.
Perfect. I'm really glad to hear that. So, kind of a recap of the whole session. You were anxious about talking to your family about your diagnosis. We gave you some strategies for that. We did some role playing, and that kind of gave you an insight on how you're going to tell them and kind of eased your anxiety with that. Is that correct?
Yeah.
And then we kind of went into some coping strategies with the journaling, and you're going to utilize that.
Yeah, I definitely feel like that would really benefit me.
Me too. And we kind of talked about support groups and finding the right fit for you and giving you some resources at the end of the session.
Yeah, I'm so glad that I came and I talked to you about that because I would have never thought about that by myself.
I'm glad I could give you some insight and some ease your anxiety a little bit. Do you have any other questions or anything else you'd like to talk about?
Nothing that I can think of right now.
Okay, perfect. If you ever need anything else, I'm always at this office from Monday to Friday and you can talk to me, okay?
Okay.
Perfect.
Active listening is a very important tool in every type of therapeutic communication. The counselor in this scenario has shown active listening through her nonverbal techniques of leaning slightly forward toward the client, nodding her head to encourage the client to keep speaking, maintaining eye contact with the client, and summarizing what the client is saying to ensure adequate understanding.